Welcome everyone to the Emedica and BDI Resourcing GP Careers in Australia webinar. For those that haven't met me before, a brief introduction. My name is Mahibur Rahman. I'm a portfolio GP based here in Birmingham and Solihull and a consultant in medical education. My main role now is medical director of Emedica, and as someone mentioned in the comments, we specialize in helping people get into GP training, get through GP training, and then with GP careers afterwards. I've written about GP careers. I wrote the book GP Jobs, A Guide to Career Options in General Practice. And our team at Emedica now, we are in our 21st year this year. And in that time, we've taught over 87,000 delegates. Joining me today to act as faculty from the BDI Resourcing team, we have Hunter, Daniel, and Ryan.
Hello.
Good evening, everyone.
Nice to see you all.
Okay, so let's go through what we'll cover today. So we've got sort of 7 areas, if you like, that we're going to cover, and we've got about an hour. The sort of talk content, if you like, we'll actually go through the material. We'll take about 40 to 45 minutes, and then we've got the rest of the time to answer questions and deal with queries. Okay, so I'm going to start with just a comparison of the healthcare systems and consultations in UK compared to Australia, and then we'll look a little bit about why you might be considering Australia. And then the bulk of the rest of the specialized information, Hunter will be covering. So he'll talk about the new Expedited Specialist Pathway, which makes it much easier for GPs who've trained in the UK or Ireland and have got MRCGP UK or MICGP from Ireland with Certificate of Completion of Training or equivalent in Ireland to very easily and much more quickly end up in a GP role in Australia without having to do any further exams at all. We'll look at the eligibility, the time frames, where can you work? That's a common question. What are the costs to actually relocate? And then a bit of an understanding, I'll touch on it, but Hunter will go into a lot more detail about the fee-for-service model and the potential earning that you could make in Australia depending on how many hours you want to work. Then we've got a Q&A, and before we go into the Q&A, we will cover some of the frequently asked questions that people have already emailed in before the start of this session. So that hopefully it covers some of the common things. If lots of people have asked the same thing, others might be thinking about it. Okay. After the Q&A, there'll be a summary, and we'll also talk to you about if you actually want to move to Australia, what are the next steps? So that's an overview of what we're due to cover. So let's make a start. So if we start with looking at the healthcare systems in UK and Australia and compare them, there's a lot of similarities. So both have universal healthcare systems. In the UK, it's funded via tax and accessed directly. For most things, people don't pay anything. In some parts of the UK, people will pay a prescription charge. But you don't pay for your visits. You don't pay if you end up in A&E. You don't pay if you need to go to hospital, even if it's something elective. The NHS covers that. So it covers GP care and hospital care. There are slight variations between the 4 home nations. So for example, as I mentioned, like in England, people pay a prescription charge. In places like Wales, Scotland, prescriptions are covered within the NHS. But there are some variations as to what will be funded, what won't be funded. In Australia, it's again funded via tax. And what happens is that it's subsidised care that people access via a public health insurance system called Medicare. And there's slight variation between the 8 states and territories that make up Australia. So, for example, if someone goes to see a GP, in some cases, they'll pay a small contribution. It's heavily subsidized, and the rest is covered through the Medicare system. If someone needs, emergency care, they'll be taken care of. But there are some things that are covered in some territories or states that aren't covered in others. Okay, so there's some slight variation. And for those of you joining us from Ireland, again, you'll be familiar, some similarities with the Australia system in that if someone goes to see a GP in Ireland, they'll typically pay a co-payment. A lot of things are covered under the national system, which is funded via taxation, but there are some things where they might need to pay, a contribution. It's heavily subsidized. Then if we look at consultations, so in the UK, it's quite common, and probably I'd say the norm still, unfortunately, to have 10-minute consultations in a lot of practices. Now, there are some practices that will have 10-minute appointments, but they have one blocked off every hour, so essentially 12 minutes. And there are some more progressive practices that are now having 15-minute appointments, which is, I feel, realistically the minimum to try to do your job well. Whenever I work in a practice, I sometimes locum in different practices. Whenever I work in a practice that's on 10-minute appointments, I just find it stressful to try to do everything properly and document and keep to time. Okay, and if we look at some studies that have been published looking at average consultation length, the UK has the shortest average consultation length in the whole of Europe. So averages between 9 minutes and 11 minutes, depending on which study you look at. And in a lot of practices, and I'd say most practices still do offer some home visits, and a lot of practices, they quite common that you might have to do visits, either most days or if you're on call. In Australia, 15 minutes is a lot more common, and you have more flexibility because you're essentially an independent contractor. So there are some practices that choose to have shorter appointments so they can fit more appointments in, but it's a lot more common to have 15 minutes, and you can book 20 or 30-minute appointment slots if you know you're going to do a joint injection or you're going to do an excision biopsy or something like that. And actually a recent study from the Royal Australian College of General Practice, the equivalent of the RCGP here, the RACGP, they found that the average consultation length in Australia is currently about 18.7 minutes. So significantly longer than the UK. And home visits are almost unheard of in Australia. You might have some GPs that it's one of their long-term patients and they're, terminal for palliative care and they're homebound, and they might choose to visit as part of offering, holistic care, but it's their choice. It's not the norm that you would do home visits. Really, really rare in Australia. Okay. And so in Australia, the way it works is that most people are independent contractors. So, in the UK, you could be salaried, in which case you get paid a certain amount per session per year. You have your hours of work, you know what you're going to get paid each month. If you're a partner, then how much you make depends on the profit of the practice. And there's a significant additional management side of admin and paperwork. In Australia, the norm is that you're an independent contractor. So what will happen is when you work in a practice, there'll be other doctors there. You're all independent contractors. However many patients you see, you get a payment for each one, and there's different ways that the costs are worked out, which will be covered in detail later. But essentially, if you see more patients, you do more, you're going to make more. And then the practice takes a cut to cover the overhead, the management, the running of the building, the hiring of the other staff, like the practice manager, reception team, nursing team, and so on. Okay. In the UK, if you have a busier clinic, if you're salaried, you're not going to make any more. If you're a partner, again, if you see more extras on a given day, you don't make any more money. Your funding is by capitation. How many patients are on your list? And then by additional things that you do. And then sometimes depending on the nature of your contract, you might get additional payments for things that you've done or things that you've negotiated or opening extra and so on. Okay. So those are the sort of broad things where there's similarities and differences. Now, if you qualify for the Expedited Specialist Pathway, one of the great things is not only is it much quicker, but you don't need any exams at all. So you don't need to sit AMC, you don't need to sit the equivalent of the MRCGP, the RACGP. You don't need to sit any exams. If you've done your GP training and got MRCGP and CCT in the UK, or MICGP, and got your certificate of completion of training in Ireland. So let's go into that in a bit more detail. So as I mentioned, this is what we're going to cover. I've touched on this. Let's look in a bit more detail about why Australia, and then go through the lot more technical aspects in detail. For that, I'm going to hand you over to Hunter Diack from BDI Resourcing. So BDI, they specialize in helping doctors find roles, whether that's in the UK or internationally. Hunter specifically works with GPs thinking about going to Australia. He's an international recruiter, very familiar and has a lot of expertise in the Australian registration pathways. He's personally supported hundreds of doctors to actually find a job, manage all the paperwork, relocate, and start and stay in their job in Australia. So, as I mentioned, the BDI Resourcing team, they've placed over 2,000 doctors across multiple countries. So Hunter's got deep working knowledge of the Australian GP landscape and system. So he's going to be able to cover these things in a lot more depth, and is your dedicated first point of contact. If after all of this you think this is what I want to do, I'd like to seriously look into this, or I'd like to look at actual jobs that are available now, you contact Hunter. He'll be able to help you navigate the rest of this. So let me hand you over to Hunter.
Hello, everyone. And thank you, Mahib, for the introduction. That's very kind. I'm just going to share with you my screen now. So let's dive straight in. So first of all, it's worth acknowledging, I imagine some people on this call have probably thought about this quite deeply. Maybe you've already established that Australia is going to be the destination for you. Others might be at a very early stage and exploratory stage and curious about this. So I'm going to try and cover this fairly broad scope. And I've tried to sort of approach this in three different sections: lifestyle, flexibility, and earning potential. So let's talk about each one of these. Lifestyle, first of all. It won't be any surprise to you, and I'm sure this resonates with many doctors who are working here in the UK. Year-round sunshine in Australia, very different to what we experience in the UK, particularly if you're an IMG who's relocated from a country with a very different climate. This might be quite important to you. Beaches, national park, we've got the Great Barrier Reef, open space, lots to do in the outdoors, quite unique wildlife as well. So for young families especially, it's a wonderful place to be based. A culture that prioritizes personal time. Now, this is really, really important, and I think this is a clear distinction from perhaps life in the NHS, where you probably can think about your own situation and do you feel like work-life balance is prioritized. In Australia, they are quite relaxed as people. They're quite laid back. I've certainly experienced that from my conversations. And finally, if you're relocating with a family, outstanding schooling system, safe environment, and so really, if it's a lifestyle change you're looking for, it does tick a lot of the boxes. Flexibility, full autonomy. So what do I mean by this? Well, you have a lot more control over the way that you work. For example, if you want to see fewer patients and do longer appointments so you can spend more time with your patients, you have the control to do that. Equally, if you're someone that really wants to maximize your income and you're happy doing 10-minute appointments, maybe you want to see 6 patients an hour, you do have the control to work that way if you wish to. But the key here is that you do have control over the way that you work. Again, flexible working hours. If you want to start early, and finish early, or equally if you're someone who prefers to start a little bit later in the day and finish later, many practices across Australia will be open to this flexibility. Equally, weekend work out of hours is available, but it is not something that is mandatory as well. So you can opt in and opt out of pretty much any additional work alongside your basic hours. Reduce bureaucracy and less admin. A lot of GPs who make the move, they do report this, that in Australia, if you compare that with their experience here in the UK, they do report less admin tasks. And finally, earning potential. So I've put some figures in here. Year one, 250,000 Australian dollars to 400,000. I've tried to be conservative with these estimates, and if you're looking at that upper figure, that is more indicative of a full-time GP. Year two, once you're fully established, you're looking at 350,000 to 500,000 Australian dollars, or perhaps even higher. Again, I am being relatively conservative. I've put the figures on the right-hand side there so you can see what that would equate to in UK pounds. So if you're comparing that with an NHS salary, you can see it is significantly higher. And again, if you're working full-time, you are looking at those upper figures. A fee-for-service model and billing freedom. So it's really important, and Mahib touched on this earlier. This is not a salaried role. 99% of GPs working in Australia do not work on salaries. They work as independent contractors, self-employed, okay? And it gives you the freedom to bill and earn in the way that you feel is best suited to your practice, okay? So why is this a good opportunity for you now? Well, at the moment, there is a shortage of GPs across Australia. There has been for years preceding today, and we do expect that will be the case, but perhaps not forever. So now is a good time to be considering the move. Shared professional standards. So Australia in general, they do look at the NHS as well as Ireland as a comparable healthcare system, and so they share many of the professional standards. So it's a good switch to make, and you can still settle in pretty quickly. And what does that mean? What has that actually resulted in? The Australian federal government has decided that they want to simplify the process, try and make it a little bit easier for UK trained and Irish trained GPs to make the move to Australia. Okay, so this is where we're now going to talk about the Expedited Specialist Pathway in a couple of slides' time. Okay, so what do the stats actually say? I think this is a good opportunity maybe to reflect on your own practice and how many patients that you see. According to the data, UK GPs see around 31 patients per day. The BMA's a safe working limit is set at 25 contacts. I think the key here is that in Australia, you set the number of patients that you want to see per day, per hour, and the length of the appointment time. So you have a lot more control over that. There's less targets probably coming from the practice that you're working in, and it gives you full autonomy in the way that you want to work. So it would be worth perhaps self-reflecting and thinking about your own practice and how that would compare. The second page here is about satisfaction. Okay, and particularly I want to draw your attention to the bottom one here. The RACGP Health of Nation 2024 report found that 73% of Australian GPs are satisfied with their job. That's pretty high. If you contrast that with the UK, it's around about 39%. If you're looking at an international average across the board, it's about 51%. So 39% for the UK, 51% international, and then 73% for GPs in Australia, which is pretty good data. And then finally, beautiful picture here. I think, don't quote me on this, but I think that's the Sunshine Coast in Queensland. So while the UK averages approximately 1,300 to 1,400 hours of sunshine annually, Australia as a whole leads with an average of 2,800 hours per year. So you're getting twice the sunshine hours. It's certainly a good move. Twice the vitamin D. I know we talk about weather in the UK in a very trivial sense often, but it does make a big difference in terms of your mood and general lifestyle. So let's talk about the pathway. Many of you may know this already. Some of you are probably at the early stage and don't know at all about this pathway. So the key here is that Australia is trying to make it easier for UK trained and Irish trained GPs. Okay. So it's worth mentioning before I start with this that prior to October 2024, any GP that was relocating would have to go through quite a lengthy pathway in terms of college assessment, getting comparability assessed by the Royal College in Australia. And that process was taking about 9 to 12 months. It was costing about 12,000 Australian dollars just to do the assessment. Well, that's now out of the window. As long as you have trained here in the UK or in Ireland, then you're eligible for this route. Okay, so it's worth noting now, sort of drawing a line in the sand, most of this presentation is going to be for those who are in their final year of training or have already completed their training in the UK or Ireland. So the Expedited Specialist Pathway is a streamlined route introduced in late 2024. Unlike previous routes, it bypasses the lengthy assessment. This allows GPs to apply directly to the medical board for specialist registration. This grants you the same professional status and billing rights as an Australian trained fellow from day one. Really important distinction here. It means that you can bill Medicare from day one. To be successful in this process, you must secure an appointment in a location that holds a distribution priority area status. So essentially, you can't go and work anywhere you like. There are certain locations where you can work. I'm going to come on to that a little bit later on. But there are many outer metro locations all over Australia that would be suitable. So who's eligible and what's the time frame? So nice and straightforward, primary medical qualification. If you studied here in the UK for your primary medical degree, you will be eligible. If you have completed your GMC registration, you would have therefore gone to an accredited university. Again, you will be eligible in this sense. So nice and straightforward there. Specialist qualifications. If you're in the UK, MRCGP UK. not MRCGP International, again, important distinction, and Certificate of Completion of Training, CCT. Okay. Ireland, MICGP, and Certificate of Satisfactory Completion of Specialist Training. So as long as you meet those criteria, you are eligible for the expedited route. Worth mentioning, if you have done some kind of combined program where perhaps you've only done a couple of years training in the UK and you've done some overseas, unfortunately, you wouldn't be eligible for this route. You still have other pathways to explore, but we're not going to talk about them today. Fitness to practice goes without saying, you will need to have a clean certificate of good standing from the GMC or equally from the IMC. Recency of practice. To meet the recency of practice standard, you must practice for a minimum of 4 weeks in 1 year, okay, or 12 weeks over 3 consecutive years. So I do get asked this question quite a lot about recency of practice. The Australian Medical Board standard is actually, the bar is pretty low to only need to have completed 4 weeks of full-time work in the last 12 months. Most GPs are going to be eligible even if you've had a career gap. Time frame. So AHPRA registration processing at the moment is about 4 to 8 weeks. Again, much quicker than previous pathways that were to any GPs that relocated 2 years ago. And realistic time frame for relocation inclusive of visa processing. So this is from the point of interview all the way to you actually relocating. You are looking at 4 to 6 months. That's if you've got all your documentation ready. Realistically, I would say 6 months you should sort of target. Most clinics that we work with, they are going to be happy to interview anyone who is ready to relocate in the next 12 months. They are quite proactive. They start this process early. If you are unsure about your eligibility and you know, please do just get in touch. We will be able to do a quick assessment of your situation. So please get in touch after this if you're not sure. You know, you're welcome to send your CV. Equally, drop us an email, let us know of your situation, and we can let you know. And equally, if you're not eligible for this route, we'll give you the options available to you. So a little bit more about this pathway and a step-by-step guide. First of all, EPIC verification, you need to upload your medical degree, your MRCGP and CCT certificate. So you need to have all 3 of those verified by EPIC for your primary source verification. You'll need to establish an AMC portfolio with the Australian Medical Council to link your verified credentials. Step 3. Now, this is the point that most of you will probably be most interested in. And also, realistically, you can start this now and you can sort of do step 1 and step 2 simultaneously alongside step 3. So this is securing a job offer and supervision. So secure a GP role in Australia. The clinic must provide a supervised practice plan. Okay, so what does that mean? It means that any clinic you go to, they must have a supervisor in place who can provide you with supervision for a 6-month period. Okay, and they must be a fellow with the Australian College. Now, is that very hands-on supervision? Absolutely not. It's not hand-holding. They already know that you've trained as a GP, you're fully qualified. It's very much a case of might be monthly sort of case review with you, and then it will be making sure that they're available on the phone in case you need any support. So it's very much remote supervision. AHPRA application. Okay, step 4. So after you have secured an offer, got a contract that you're happy with and you've accepted, you then will submit your AHPRA application for a grant of specialist registration directly to the medical board. Once that is approved, we move on to visa processing, Medicare provider number issuing, and then you are pretty much ready to start work in Australia. Again, if this is the first time you're looking at this, you might be a little bit unsure about this process. It is now well trodden, but again, if you're unsure, get in touch with us. We will be able to guide you through it accordingly. And equally, if you secure a position, we'll guide you through it step by step. So this is probably the more exciting part of this. So where can I actually live and where can I work? So some of you may have a really good knowledge of the geography of Australia. Others may not have a clue at all. So I'm going to, again, keep it very broad stroke. The key to this is you must work in a distribution priority area, or DPA. Now, what does that mean? If you have started looking at opportunities, you will have seen this term DPA already. And essentially, the Australian federal government has said certain areas of Australia there is a shortage of GPs, and so we are opening this up for international recruitment. There are other locations in Australia where it is not approved for DPA, so they're non-DPA locations. So I'm going to tell you the difference between the two. And another way that they classify regions or locations, catchment areas in Australia, is by the modified Monash model. Okay, you may have heard of it as the Monash scale as well. So that ranks from MM1 all the way up to MM7 and everything else in between. MM1 being the metropolitan areas, so that's the cities. Think of places like Melbourne, Brisbane, Sydney, Adelaide, Perth. They're MM1. The outer areas of those would be MM2, and then you've got MM3 all the way up to MM7. MM7, you're probably looking at these areas in the outback of Australia, very rural, quite isolated. Okay, not perhaps for everyone. Now, one of the concerns is if a DPA location, do you have to go to one of these rural areas? Well, that's not necessarily the case. Okay, so I'm just going to actually open up an interactive DPA map that we've put together. And we will provide access to this following this meeting. So you can go in and have a play about with it. You can have a look at different locations and you can see what's good for you. Now, this is a map of Australia. You will notice most of the locations where clinics are based are on the sort of coastal regions. And that's the case for most of Australia. In here, not too much going on. And these are the places that most people are interested in. Okay, so I'm just going to zoom in and take a quick case study. Okay, you will notice that most of the map is sort of pinky purple color. Okay, and I'm going to zoom into Brisbane. So this is up in Queensland, and you can also see the Gold Coast down here, just on the south side as well. So you'll notice that that area, that metropolitan area, is grey. Okay, so what that means is this area with all these clinics in the grey area is non-DPA. So as an IMG going to Australia for the first time, you cannot work in this catchment area. You need to work in one of these purple zones. Okay, the good news is there are lots of these locations where there's many DPA clinics. Ipswich is a suburb where I know we've had lots of interviews for GPs lately. 23 clinics in here. Equally, Caboolture here, 18 clinics. We've and Murrayfield, places like this where we've had interviews very recently. Only about 30 to 40 minutes outside of Brisbane. Okay, so very, very close and well connected. Places like Tweed Heads as well, very close to the Gold Coast. Why is this bit non-DPA? Well, the reason is they get plenty of Australian applicants applying to these positions. And so the government has said, we need to prioritise those applications. The places where we're struggling, this is where we will open up to IMGs. Okay, just going to take another quick case study. Where do I get asked about? Where else do I get asked about a lot? Melbourne. So let's have a quick look at that as well. So again, you can see as you come into that metro area, this is grey, so that means it's non-DPA. But where can you work? Well, there's a suburb here with 56 practices. That's about 20 minutes from CBD. You've got a suburb in here where they've now qualified as DPA. Places out here on the peripheral. You've got places like Geelong, which is only 1 hour from Melbourne. This peninsula down here where there's lots of places. So if, for example, you're someone who has friends, family in Melbourne, and you know that's where you want to go, don't panic. You can still go to this place. You're probably looking at one of these types of areas. And equally, you could live in Melbourne and commute out. Or equally, this is going to be a lot more affordable than living in the centre of the city by choosing one of these suburbs that's surrounding. So there are plenty of options available to you. And I think the key myth sort of to bust here today is that DPA area does not mean that you're going to be isolated in remote places in Australia. You can see by looking at the map, pretty much the whole landmass of Australia is DPA for GPs. Okay, you'll have lots of other cities, small cities in these areas around here that will be very, very suitable. And I guess the other thing to mention is just to be open-minded. I get asked often about Melbourne, Brisbane, Sydney, but that's because they're the places that everyone has heard of before they've actually relocated to Australia. In the same way, if you were coming to the UK for the first time, you'd probably ask me about London, Manchester, Birmingham. Not everyone ends up working in London and Manchester. And actually, if you were thinking about perhaps before you move to the UK, if you are an IMG, you probably maybe you would choose to live in London, but a lot of people wouldn't, especially if you've got families and things like this. So again, the more affordable places are going to be perhaps towns and smaller cities that are not the ones you've heard of today, or the one up until today. So I would say keep your options open. Again, this map, if you need help navigating it, get in touch. We will share this with everyone so you can have a look, because if you've got a particular suburb in mind, you'll be able to quickly go and check and see if it's DPA. And equally, if you're not sure, come and get in touch with us. Just going to close back and go back to the presentation. Hopefully that's given you a good idea of the types of locations that we're looking at. And so we're going to move on to what are the costs associated with relocating. This might be a concern for some of you. Obviously, relocating to a new country, there are going to be costs involved. The first part of this is the registration costs, okay? So you'll need to open up an AMC portfolio. That's about 642 Australian dollars. Primary source verification, you do need to verify 3 credentials: primary medical, your MRCGP, your CCT, or your equivalent Irish credentials. You will need to submit an AHPRA application, which is about 1,500 Australian dollars. And then finally, you'll need your specialist registration fee, which is around $1,000. Okay. So in total, that's about $3,000 for the registration costs. Okay. Worth just comparing that again with what it was prior to 2024, about 12,000 for a comparability assessment. So good news is this is much more affordable. Equally, I've just put the UK pound equivalent on the right-hand side. So if you want to work it out, it's about 50% of any figure that you see. The current exchange rate, I think, is about 53 pence to the Australian dollar. So $3,000 for your AHPRA registration is about £1,500. Okay. Visa costs. This is probably going to be the most expensive part, but for most people, especially if you've got family. Okay, so you'll be relocating on something called a skills in demand or subclass 482 visa. Very similar to a skilled worker visa here in the UK, in the sense that your dependents can come with you, but it's a temporary visa. So main applicant and adult dependents, the cost is 3,210 Australian dollars per applicant. If you want the equivalent, that's about £1,700. Child dependent is about $800 per applicant. Again, about £425. So you can work out your own situation, how much that is realistically going to cost you. For example, say that you're a family of 4, 2 adults, 2 kids, then you're looking at around about 8,000 Australian dollars, which is about £4,000. The good news about this is that you will probably only have to pay for one of these visas. Reason being is you'll get at least a 2-year contract. Often they will appoint you on a 2-year visa or even anything up to a 4-year visa. And you can actually apply for your permanent residency after 2 years in Australia. Okay, so it's a much quicker process than it is here in the UK. No 5 years for your indefinite leave to remain. It's just 2 years with your employer, and they will then sponsor you for permanent residency. Again, it's another sign that Australia is making it easier for IMGs. I know obviously in the UK, it's more difficult for them to get into training, more difficult to from an immigration perspective and so forth, but Australia is making it easier. What other costs do you need to consider? Flights, they're going to be variable dependent on your situation. Short-term accommodation, if you need it when you arrive, again, is going to be variable. So these are worth considering. The good news, relocation allowance. Now, most practices are going to offer this in some form. And so you will likely find that it could vary from anything from 5,000 Australian dollars, anything up to 20,000 Australian dollars. It depends on really where you're happy to go to. It depends on the type of organization you're joining. It depends on whether you're going to a really rural place. If you're going to a metro area, likely they're going to understandably offer you less because it's more competitive. Go to a really rural place, they're probably going to offer you slightly more. And the good news is that's going to cover most of these costs in a cash installment once you arrive in Australia. So how much can a GP earn in Australia? I'm going to talk about a couple of different things here. The first one is factors that will actually affect your earning potential. You'll notice on the first slide that I shared with you that there is quite a big range, so 250 up to 500,000 Australian dollars. You might be thinking, well, which one is it? Well, the truth is there are a number of different factors that are going to implicate your income, and that's why we have to give a range. And remember, it's not a salaried model, it is a fee-for-service model, and you're working as an independent contractor. Typical take-home example for a full-time GP, we will cover that, and then an overview of the typical billing models used. So what are the factors that will affect your income? First of all, the billing model. You may, if you've started looking at opportunities, you would have come across these terms: mixed billing and bulk billing. Depending on which type of clinic that you go to, there is a different way of operating, a different way of fee collection, and so forth. So it is going to affect your income, and we're going to talk about that in one of the following slides. Patient volume. Again, remember it's fee for service, independent contractor, so no salary, meaning the more patients you see, the more you're going to earn. So whether you want to break that down as number of patients you see per hour, number per day, number per week, you'll be able to work out what it is that you're going to earn. Working hours and out of hours, again, sort of self-explanatory. If you're working more hours, you're going to see more patients and you're going to earn more. Out of hours, some of the clinics will provide out of hours service. This is not mandatory, it's always optional. And if you want to do that, they will probably provide you with a better service fee agreement than your standard clinic working hours. Service fee percentage. This is going to have a big impact. Okay, so you will have some kind of contract arrangement with your employer where they will take a percentage of your billings and you will keep the rest. Okay, so typical fee agreement might be 70% to the GP and 30% to the practice. Like Mahib mentioned earlier, what does that 30% cover? Well, it's all the support staff. It's a room to operate out of. It keeps the lights on. It's the admin fee, admin costs and everything associated with it so that you can turn up, see patients and make money. 30-70% is pretty usual split, either or 35-65%. You will see a range anything from sort of 40-60 up to 75-25, although they're quite unique, those offers. So yeah, 70-30 is pretty good. And then finally, item number optimization. What do we mean by this? Well, every different type of consult that you have or procedure that you have will be charged at a different itemized cost. Okay, so earnings will vary dependent on the complexity. You will have a standard consult fee, which might be a 10-minute or 15-minute appointment. You will then have a longer consult fee. And then you will also have different fees associated with mental health care plans, chronic disease management, procedural skills, like I mentioned. All of them will have a different itemized cost. So this is really where you get to supplement your income and increase it significantly, okay, by doing additional procedural work and chronic care plans or mental health assessments, whatever it may be. Okay. Again, location might have a factor over what you're going to earn. Rural and regional areas may offer more attractive fee arrangements or additional incentives in the form of a bonus to work in those rural places. The metro areas, perhaps not so much. Again, all of these factors, we are here to help you. If you're not sure when you're arranging your contract, we can help guide you. We can also help with that negotiation to make sure that you're getting a contract that you're happy with. So the fee for service models. So as I said, you probably, if you've started looking at roles, you may be familiar with these different billing mechanisms. If you haven't yet, you probably don't know. So first of all, let's talk about bulk billing. So there's no out-of-pocket cost to the patient. It's accessible to all, okay? Much like the NHS. What does this mean in practice for you, someone working in the clinic? Well, you're probably going to have shorter consultation times. They might be 10 to 15 minutes. You're probably going to have higher patient volume. So you're maybe seeing 5 to 6 patients per hour if you're very busy. And you are likely to receive some additional, well, you will receive some additional incentives. Okay, so the federal government has announced a bulk billing incentive program. Okay, so it's 12.5% quarterly loading, meaning they pay out 12.5% to the practice for any fee that you have generated as a bulk billing GP. and you get to keep 50% of that. The practice keep 50%. And that means that every 3 months you're paid out additional incentive in a lump sum. You also get to triple bulk bill on eligible items. Like I mentioned earlier, there's higher itemized costs for mental health consultations, health assessments, chronic care plans, after hours, and so forth. Simple admin, okay, so Medicare billing, there's no gap collection, okay, which is different to the mixed billing model, which I'm going to come on to. In practice, this does mean requires a higher patient throughput to maximize your income. Okay, per consult income is capped at the Medicare schedule fee, meaning that lower per consult fee on average and slightly higher patients. So let's contrast that with mixed billing. So why is there a higher per consult income? Well, this is because it's partially private. Some patients pay a gap fee on top of the Medicare fee. Okay, so what does that mean for you? Longer consultation times, likely 15 minutes, sometimes 20 minutes. I think Mahib referred to earlier, average of 18-minute appointments. That's probably quite familiar for most GPs working in a mixed billing practice. Patient volume is going to be moderate. You're probably more like seeing 4 patients per hour. So it's higher per consult income, fewer patients per day, so longer, more flexible consultation times. If you're someone that likes to spend a lot of time with your patients and give them that care, you may be opting for this route. Flexibility, so you can actually choose in most cases where you want to bulk bill and where you want to mix bill, okay, or where you want to privately bill. So, for example, you may bulk bill pensioners and children under a certain age. And I spoke to a practice yesterday who said we bulk bill everyone under 10 years old, and then all the pensioners as well. Everyone else in between pays a gap fee on top. Bulk billing incentives still claimed on any bulk billed consultation. However, you do not receive the 12.5% loading that is available for a fully bulk billing clinics. You don't get that incentive quarterly. Moderate admin, gap payments require collection process. There's a little bit more admin involved than a bulk billing practice. And this is, again, not a free service for the majority of patients. Majority of patients are going to pay a gap fee. Hopefully that's given you a sort of overview about the difference between the two practices, between the two billing mechanisms. I would say it's about a 50% split in terms of half bulk billing, half mixed billing across Australia, although a lot now are shifting to bulk billing because of the bulk billing incentive that government is offering. Again, if you're not sure which is the best one for you, speak to us. We'll be able to guide you based on the way that you work, what your motivations are, as to what will be best. So what's the typical salary for a full-time GP? We have looked at this earlier but I'm going to cover this in a bit more detail. So I have put all 3 billing models here. So you've got fully private on the right-hand side, and that's really in just for a contrast. So you can see that if you go fully private, you can see less patients. You're going to be charging higher per patient. This is probably not going to be a type of setup that you would be working in as someone who's going to Australia for the first time. And the reason for probably less than 5% are fully private, and most of them are established GPs in Australia who are working in those who've built up a patient list for over a number of years and have loyal patients. Most likely you're going to go to mixed billing or bulk billing. So let's focus on these two. You can see the difference in appointment length and patients per hour. The key thing that I want to just highlight here is the total bill per consult. So you can see the difference between bulk billing and the average in a mixed billing practice. This is going to be higher in mixed billing, lower in bulk billing. And then you can see based on a 45 weeks per year what you're going to be earning. So again, this is a very conservative estimate because we are only taking into account the standard billing consult or standard 15-minute appointment, for example. So we're looking at $64 or $82. We're not taking into account any additional procedural work that you're doing, any additional care plans that you're doing. All of that is supplement on top. Okay, so if you're working full time, this is the figure that you're looking at approximately if you're in a bulk billing practice, and this is the figure in a mixed billing practice. The reason that it's worth showing to you, they're very similar incomes, and there's not going to be a huge difference just by the simple fact whether you go to a bulk billing or mixed billing practice. There's going to be a number of other factors that are going to impact this. And part of the reason for that is the incentive that the government offers for fully bulk billing practices. One thing I want to share with you today, just going to link away again from the presentation and share with you another tool that we have built. Okay, so you will have access to this following this webinar as well, so you can go in and have a play about and see what exactly you think the way that you might operate, and see what you think you'll be earning. Okay, so for example, we can change all of this. So you're in a mixed billing practice. I spoke to a mixed billing practice yesterday that said their fees are set at $94 per consult. And you might decide, well, actually, I'm not going to work 5 days. I'm going to work 4.5 days per week. So I'm going to have a half day on a Friday. And I've arranged with my my clinic that actually it's going to be 70% initially, and perhaps I'm thinking I'll probably see about, I don't know, 28 patients per day on average. And there we go. We can see what the figure is approximating. Again, this is conservative because we're not incorporating any of the fees you're generating from from procedural stuff, from additional health plans that you're doing. Again, if you're thinking, well, actually, I have arranged an agreement with my clinic that they're going to pay me 72%, and I'm actually going to see 32 patients per day, then you can see what the estimated annual income is. Again, you might decide, well, actually, I'm going to roll back my hours. I've been in Australia for a couple of years. I'm going to only work 3 days a week. And then you can see what your earnings are going to be again. Okay, so have a play about with that. Hopefully that's helpful to give you an estimation of what you can possibly earn.
Just before you go on, Hunter, I just wanted to
Yes.
go back to that calculator. I just want to highlight
Absolutely,
something
yeah.
for everyone, is that to make it fairly comparable to what would be common in the UK, you can see that Hunter's put in here working weeks per year is 45. Because a common mistake, people will think, oh, I'll charge this much, see this many patients, 5 days, and then multiply by 52. That would overestimate. We're being realistic. 45 working weeks means that you can have 6 weeks off and 1 week for study. So that's very similar to a lot of practices in the UK where people will have 6 weeks annual leave and 1 week for study.
Yeah, absolutely. And I think the key with this is we're trying to be conservative because we don't want to promise the world, because obviously this is a significant increase on an NHS salary anyway. The reality is, though, if I come back to this page and we're looking at a realistic salary range, if you're working full time, you're going to be looking at this upper limit. You're going to be close to that, whether you're in a mixed billing practice or bulk billing. And I mean, once you're established and once you include any of the additional consult fees on top, whether it, procedural stuff and additional plans. So realistically, for anyone who is comparing this with an NHS salary, you are looking at doubling your income. That is possible, perhaps even tripling your income in the long term. That is realistic. So finally, from me, actually, there is a couple of slides after this, but how can BDI support you? So as Mahib had sort of alluded to earlier, we've been helping international doctors relocate for about 10 years now. I've been doing this for about 8 years in total, 6 years with BDI. So what does this look like for you? Well, we'd start off with a role search. So extensive search across our network of practices. We work with large organizations who have many practices. We also work with the small independent clinics as well. We'll find a role that suits you based on your interests and your personal preferences. Once we've got a position you're happy with, we'll then negotiate a contract that you're happy with as well. Okay, really important that we get the billing percentage right, the guaranteed earnings, supervision arrangements, relocation allowance, everything that you need to be assured that this is the right move for you. Once you're happy with that, we'll move on to the AHPRA registration. Okay, we referenced the step-by-step guide earlier quite briefly. We'd give you a more in-depth knowledge of this by this stage, and we'd also guide you through it step by step. So we'd make it nice and smooth for you. And again, we'd work with the clinic to make sure that they have the supervised practice plan in place for you, ready for approval. Once you've had your registration granted, we'd move on to your visa support. So you would be sponsored on a 482 skills and demand visa. So the employer would nominate you for one of these visas. You'll then make your application. When you do so, if you're going to one of the large networks, they may put you in touch with an immigration agent. to help you through that process. If you're going to a smaller independent, they probably aren't going to have an immigration agent in place. Nothing to panic about. You can do this on your own. Just make sure you have the documentation correct. Try and do everything properly. If you do want that additional support of an immigration agent, we can put someone in touch, but there are obviously costs involved with that. Once you've got your visa back, pastoral care throughout. Just to let you know the way that I work, because I'm trying to bridge the gap between, well, I'm based here in the UK because I'm trying to bridge the gap in the time difference, or bridge the time difference with Australia. I'm often up at 6 a.m. having client meetings, at 11 o'clock at night doing interviews. The reason I'm mentioning this, I will make myself available for you 24/7. If you have questions, have concerns, if it's out of hours, don't worry, get in touch. Bring your questions, your concerns to me. We'll try and find a solution, and we're here to help and support throughout. Accommodation in schools, so that pastoral care goes all the way through to helping you find accommodation, schools, practical relocation advice. For some doctors, you prefer to take that all into your own hands, fine. For others, you need that additional support we can help you with. And truthfully, most clinics across Australia, they're very, very welcoming. They will help out where they can. They'll introduce you to local GP networks as well, so you can hit the ground running when you arrive. Finally, from me, our fee is paid entirely by the employer. Okay, really important, never the candidate. So there's no fee for our service attached to getting in touch with us or helping you secure a position. All right, no hidden charges, no repeat fees, no obligation. Every GP we work with receives the same level of personal attention, regardless of where they end up placing. All we ask for in return is honesty, transparency. That's all we ask for. Okay. So hopefully that will be helpful for you to know about how we can support you. I'm now just going to move on to some of the frequently asked questions. So first of all, do I have to work in a rural or remote area, or can I live near a city? Well, hopefully we answer that with the DPA map. There are many DPA locations that are very, very close to the main cities. Okay, so those outer metro areas, you could be 30 minutes, 40 minutes from the main city, whether that's Brisbane, Sydney, Melbourne, wherever you want to be, Perth. Yes, you can live and work near a city. You don't have to go to the outback. We're not going to send you there if you don't want to. Maybe you want to. I know some doctors want to go and do a rural fellowship and go and work there. Equally, that's brilliant. How long does the whole process take from decision to arrival? Mentioned this earlier, probably 4 to 6 months. I would say realistically 6 months. Again, most GP clinics are going to be happy to start looking at meeting with you 9 to 12 months out from the point of when you're going to relocate. They do start the process early. Worth actually mentioning that visa processing is different for everyone, depends on the complexity of your application, depends on the number of dependents, depends if you have all your documentation done correctly. I've had some doctors that have had their visa approved in 1 week. I've had others that applied in December and are still awaiting an outcome. So it really depends on your application. Do I need to pass any clinical exams to register in Australia? Mahib mentioned this earlier, no clinical exams, okay? As long as you have your MRCGP and your CCT in the UK, or if you're from Ireland and you have your equivalent qualifications there, MICGP, and your completion of training, you do not need to do any additional clinical exams. Can I bring my family with me to Australia? Yes, absolutely. Much like the UK, we have a dependent visa system. And so if you're sponsoring a 482 visa, they will be able to come with you. I have had a couple of questions about parents being relocated as dependents. That's where it proves quite difficult. If you want to go down that route, if you feel like you've got parents that are qualified as dependents, then you would probably need to speak to an immigration lawyer to get approval on that. It's not something I can guide you on. The criteria is quite strict. So for most cases, it's unlikely. But absolutely, wife, husband, children, no problem. What's the cost of living like in Australia compared to the UK, and will I be better off financially? Really important topic of conversation at the moment. If you've lived in the UK last 5 to 10 years, you'll keep seeing costs going up, whether it's your cost of renting a property, groceries, fuel costs, and so forth. I can't promise you in Australia it's going to be much cheaper. There are more affordable places to live, but equally, if you want to go and live near Sydney or in Brisbane, Melbourne, it is going to be quite expensive. But the key here is you are going to be earning significantly higher, right? You are financially going to be better off because you're probably going to be earning twice the amount in Australia. Will I be able to achieve fellowship of the RACGP after relocating via the expedited route? Important thing to mention here, the expedited route is not automatic status of does not automatically give you fellowship status, right? So this is not an application to become a fellow. This is an application to get um, specialist registration and to be able to bill Medicare from day one. The good news, if you are a UK trained or Irish trained GP, you will be able to apply for fellowship after you've completed 6 months of supervision. So once that 6 months is over, conditions on your registration are removed. You can then apply for fellowship status. It will be approved. There's no additional exams that you need to do. I think there's a cost of $990, if I'm not mistaken, something like that. And you have to complete a questionnaire and something else, but there's no exams, and they will approve you as a fellow in Australia. And I know that'll be important to many of you. Can I get permanent residency in Australia as a GP? Yes, spoke about this briefly earlier. 2 years on a 482 visa, and you can apply for permanent residency. You will be sponsored by your employer to do so. Nice and straightforward, which means you probably don't have to pay for multiple visas, just your initial visa. I know I'm sure some GPs might be asking the question about PR from day one. It is technically possible. However, it's very, very difficult. There's high processing times or long processing times for that. And equally, you are not looking at a financially beneficial model. You're looking at the contractor model. You're looking at a salaried model, which is probably not gonna, it's probably gonna sort of not be the reason. One of the reasons you're moving to Australia is to financially gain. You're not going to receive that for at least 2 years if you go through that route. And most clinics are not going to offer that. 99% of GPs relocating to Australia are going to go on a 482 visa to start with and then get PR once they are in Australia.
So someone's asked, while I appreciate that you're an independent contractor and you could choose how much or how little you work, is there a minimum to maintain the 482 visa?
Yes, so it is, although it's not actually written into Australian law, to the best of my knowledge, there is an expectation to work on a 482 visa that you would do a minimum of 30 hours on average. That is what they sort of stipulate, or what they consider to be anything less than 30 hours is part-time. And so before you get permanent residency, you will be expected by your employer to work a minimum of 30 hours per week during that initial 2 year period. That would be the expectation. So I would go into this with that sort of mindset.
How tax rates in Australia compare to UK?
Yeah, really important. I think the first thing to mention is Australia is not like some places in the Middle East where I know that, tax rates are really low and you're going to pay little to nothing in tax. Australia has a progressive tax system. It is quite similar to the UK in that sense. Even though you're working as an independent contractor, you will still be paying similar tax rates. So I would say in general, if you're a high earner, you're probably looking at paying in the region of around 35 to 40% in tax. I read an article actually earlier today that was saying it was an averaging around 38%. The good thing is, as an independent contractor, you can a lot of your costs you can have anything that's work related, whether it's your indemnity insurance, your costs for registration and so forth, can be essentially you won't have to pay the tax on that income. So there are lots of smart ways that you can financially benefit from paying for a number of these costs, which is beneficial to you. But generally speaking, you're going to pay a similar level of tax to what you do in the UK. Might be slightly less.
A couple of people have asked about age. They may have read about this age cutoff of 45. If you could just go a little bit more into detail about that and about permanent residence and how it might impact that.
Yeah, absolutely. So you will hear a lot about the 45-year mark. Okay, so it is true that for permanent residency applications, that there is a 45-year mark that you need to apply before your 45th birthday. However, there are exemptions. Okay, one of them being if you're working in a location that is considered where there's a shortage of GPs. So if you've spent 2 years working in an area that's considered a shortage of GPs, and I think most DPA clinics would make you eligible for this, then you will still be able to apply for permanent residency as long as your employer sponsors you after the age of 45. The other factor is your income. Okay, so if you are a high earner, which you would be expected to be, that's the other sort of criteria you need to meet. So the good news, if you're over the age of 45 and you're concerned about that rule, you will initially have to relocate on a 482 visa. You probably will do that for 2 years. As long as you stay with the same employer and you're in an area where there is a shortage of GPs, and that's probably going to be DPA, then you will be able to be sponsored for permanent residency.
Someone's asked, what would happen to a UK NHS pension if you work abroad? So if you've been in the NHS pension for more than 2 years, you, at that point, are locked into the pension. What that means is you can't ask for a refund of what you've paid. Less than 2 years, if you want to leave, you can get a refund of what you paid, less tax, because you remember you got tax deducted at the time. They'll take that back, so you don't get back everything that, as much as you put in, because you got a tax benefit and you'll be taxed now. But what happened is, if you've been in more than 2 years, what you've already paid in will stay there and continue to grow, but you won't be able to access it until you reach pension age. So, when you're 67, some of you are young, so by the time you get to it, it'll change. You'll be 68, maybe 69. At that point, you will get probably a small pension if the rest of your time was in Australia, because it would have been the number of years of service and the average that you had. There's a formula based on that. And then it does grow, it's index linked, so they do take account of inflation and add a bit more on top. But you wouldn't be adding to that. What you would do, though, is in Australia, you could choose to take a pension there, or you could pay into a private pension here, for example. Okay, but what you've paid into the NHS, if you've paid into it for more than 2 years, that's basically locked and will continue to, and you'll get a small pension based on that. Could you work in the UK while you're on your holidays to stay on the performers list? It's an excellent question. I actually would recommend that maybe the first year, use some of your annual leave, come back and just do a few sessions in the UK. Enough that you do an appraisal in the UK, just so that you stay in the cycle. And you might need to fill in, if you're doing less than 40 sessions in the UK, you might be asked to fill in a low volume of work. How are you keeping up to date if you're doing less than 40 sessions? Well, you can say, well, I'm still working as a GP in a comparable system, and still show that you're still doing CPD, do your appraisal. What that would allow you to do is that, as Hunter said, usually a contract's going to be for 2 years initially, and then after that, you might get permanent residence, and then you've got more flexibility. By that time, you probably know, do you want to stay there long term? Sometimes people go, they might enjoy the work, but for example, a family member, you've got an older parent and they get an illness that, you didn't know was going to come out of the blue. And you think, I want to be closer to my mum. I need to be there to care for her. And so sometimes people come back. And that could happen in any job anywhere. Sometimes it doesn't work out, right? Something else happens outside of the job's control, outside of your control. And so what that allows you to do by doing a few sessions, staying on top of your appraisal, it would allow you just to stay on the performance and just walk back into a job here. Okay. Whereas if for 2 years or more you've not worked at all in the UK and you're off the performance list, if you then want to come back to work in the UK, you'd have to go through the returner scheme, which will need exams and a period of supervised practice. And so it's not as straightforward as just staying back. I would only recommend you do that really for that first year or two until you get your PR. And that's because to do that long term is not really sustainable. You need your holiday to have a break. Do you see? So it's okay for a year to do it. It's okay for 18 months. By that time, you probably know what's happening, right? To keep doing that every year is not really sustainable. You want to use your holiday to have a holiday, to have a break. Could we practice as a GP with specialist interest or extended role in the UK, like in the UK? Absolutely. It's very common for Australian GPs to do a lot more procedural things, and you get a higher payment for that. So for example, some of you might know, I did orthopedics before I did GP. And so, I had a private practice here in the UK. And so, we would charge more if I was doing a joint injection than if I was doing a straight consult, seeing someone and, maybe examining it and just prescribing something or giving advice. Similarly, in Australia, if you're doing a procedure, the fee for that is going to be more than if you're just seeing someone and giving a prescription. And those that have already got those skills, or if you wanted to work towards getting additional qualifications and developing, if you can do excisions for basal cell carcinomas, Australia, the flip side of having twice as much sunshine as the UK, there's a lot more incidence of skin cancers in Australia compared to the UK. And so, if you can do procedures like biopsies, like shave excisions, if you can actually get accredited and excise basal cell carcinomas, you get a significantly higher rate than a normal consult. And similarly, you could potentially, if you've got other skills already or wanted to develop them, you could do other things like joint injections, like fitting coils, implants, and you'd get a higher rate for those things. I don't know if you want to add anything to that, Hunter?
Yeah, the only thing I would add is just from my experience speaking to a number of clinics, when we ask about subspecialty area interest, if there's anything essential, often they just say, whatever skills that you have, we will utilize them. I mean, great if you have, subspecialty interest or skills in things like dermatology, procedural stuff. Equally, women's health is something that comes up a lot. But whatever skills you can bring to the table, they will often utilize, and they're not mandatory. But yeah, absolutely. There's the procedural work is one of the ways that a lot of GPs will significantly supplement their income. So just in summary, just to recap, what's on offer? Well, it's a lifestyle change, better work-life balance, more autonomy, more control over the way that you work. In Australia, you've got a higher earning potential as well with this fee-for-service model and working as an independent contractor. And why is this a good time to go? Well, it's a simplified registration pathway with the expedited route, reduced processing time, less cost involved. So a life-changing move awaits you. So please do get in touch, and any questions you have, anything you're not sure about, we can answer them. If we don't have the answers, we'll go away and find them. And then just finally, if you want to have a read of some of our reviews, please go ahead, go on Google. You'll see we've got more than 400 5-star reviews from our candidates that we've placed. 2,000 doctors we've helped, more than 2,000 doctors with international relocation. Been doing this quite established for 10 years, and we've recruited doctors from 46 different countries around the world. So yes, that's everything from me.
Great. And really to say a huge thank you for Hunter for really going into that in a huge amount of depth. Thank you to the rest of the BDI team that have been in the background answering questions, but also preparing things, to get this ready and get you on board. So huge thank you to Daniel and Ryan. If you're interested, do get in touch with the team and ask any questions, get clarity on anything that you're not sure on. And some of you might have some specific questions that you want to follow up on, get in touch and the team will be able to support you. A huge thank you again to the whole BDI team. Thank you so much, Hunter, Daniel, Ryan. Thank you again to all of you for joining. Like we always say at Emedica, prepare and you will succeed.